how does fibroid form? Why would a woman develop fibroid? What is the whole process of the formation of fibroid?
Okay, thank you very, very much. Fibroid is one of the tumors of just like a growth. When you say growth, something that like a swelling, something that grows from a particular part of the body. But this part of the body where this tumor grows is the female genital tract, the womb itself. So it's good to know that fibroid is just a disorder you find only in women. You don't find it in men because, of course, men do not have womb. So it's a problem of women. And it's very common. It's a very common problem, which is usually underestimated, because it's been said that over 70% of the women you see have a uterine fibroid. And of those 70%, only about 20 to 30% will come to you with complaint. So almost for every woman you see, most of them will have, just even if it's a small fibroid seedling, they will have it. But just a fraction of this, like, 2 in every 5 people that will come to you with complaints that they are having symptoms of that uterine fibroid. Now,
yes, sir.
The real cause of this fibroid is still unknown. What usually triggers that first swelling to begin to form inside the womb is still unknown. But there are predisposing factors. There are certain things that we somehow make a woman to have some of this, for some of this fibroid to grow in the womb of some of these women. One of it is genetic. If you have a family member, like your mom had a fibroid, your sister had a fibroid, you had a twin who had a fibroid, somebody who is in that your lineage that had a fibroid, the chances that you may also have it is there. Now, racial predisposition. Blacks are more likely to develop fibroid than white women. There's also this racial predisposition. There are other predispositions. Now, women who are in their reproductive age group are usually ladies who are between the age of 15 to 49 years of age. Because of the influence of hormones, fibroid growth is triggered by certain hormones. And these hormones basically are either estrogen or progesterone. These are 2 major hormones that are elaborated in female. Now, what happens with this hormone? They potentiate the subsequent growth of the fibroid, along with some other growth factors, which I'm going to mention later. But the growth of this fibroid is very hormone dependent. That is why the disorder, the disease, is not common in women after the age of menopause. When a woman enters her menopausal age, you see that the woman does not begin to grow fibroid. If a woman has a mass, a swelling on the womb after age of menopause, a doctor should not be thinking that that woman has a fibroid. It's better to explore other possibilities than to start thinking that that woman has a fibroid. It's also not common or almost not found in women before they start seeing their period. That's why you don't find it in younger children. So because at that age, this hormonal milieu is very low. The estrogen and progesterone levels are low, so you can't find it in younger children like that. Although some very rare cases have been reported in smaller children, but it's not common to find in such ages. Same thing applies to women who are obese. Women who are obese also have a very high chance of developing uterine fibroid. Why? Because they elaborate a lot of hormones, estrogen and progesterone. And what happens is that those excess fats they have seems to be undergo a process they call aromatization. And once that happens, you have more estrogens flowing in the system. And of course, the fibroids, even when they have been very little, will begin to grow. And that's one of the factors. Another factor that people also consider is some level of pelvic infections. It has been seen that women who are having recurrent pelvic infection, like pelvic inflammatory diseases, seem to have more chances of developing these small fibroid masses as compared to other women. The precise reason is unknown, but there has been this association between the two. So you could see that these factors are there. Obesity, women within the reproductive age group, and then of course, women with low parity, women who have not given birth before. Women who have not given birth before, the chances of elaborating more hormones over the years are higher. So a woman who has no child at all is more likely to grow more fibroid as compared to a woman who has had 3 kids, 4 kids, 5 kids, and all that. So these are the predispositions. So they are common like this. But the very first trigger of why a particular fibroid will begin to grow in a woman is still unknown. The whole process is seen as a metaplastic process, just the way cancer develops. But these fibroids are not cancerous at all. They are not cancerous. They are not cancerous at all. The chances of a fibroid developing into a cancer is very low. It's less than 1%. There's a change that will happen in a fibroid called sarcomatous change. Sarcoma means malignant transformation. So what happens is that the fibroid begins to change into a tumor, becoming cancerous. The risk is very, very low. It's less than 1. So we don't consider the very first time you see a woman with a fibroid mass, which you can easily demonstrate clinically or with just a pelvic scan, you will say, yeah, this should be a benign. And oftentimes they are benign lesion of the uterus. So they are really not much of a problem.
So, sir, I want to ask one question, sir. For the symptoms of fibroid, because there's so many speculations. People will tell you that, if you are having abdominal pain, then you have fibroid. If you have abdominal swelling, then you have fibroid. So, sir, can you help us break the symptoms of fibroid down?
All right. Thank you. Thank you very much. Fibroid had a very wide range of symptoms, very, very wide, from asymptomatic. So many of these women who have a seed of fibroid will not present with anything. Many of them are asymptomatic. It's only 20, like I mentioned, over 50% of cases, they won't have symptoms. Only 20 to 30% of women will come to you with the fact that they are having symptoms of this problem. Others are just discovered on preliminary investigations for other things. A woman may have come to you for a gynecological problem, maybe infertility or other issues. And you will check, you say, this woman is having an abdominal mass. She may not have even known that she was having this problem, or trying to perform a scan for such women, you just say, there's a fibroid lesion in this woman and all that. So it could be asymptomatic, in which case the woman will not have any symptom. But in cases where a woman presents with symptoms, the commonest symptom you will find in these women are either heavy menstrual bleeding, menstrual problems, or swelling of the abdomen. Abdominal swelling is usually slowly but progressive. It will just be slowly growing. Sometimes, at the initial phase of the woman developing the fibroid, the woman may just observe a little mass around her suprapubic region. Then over the years, you may notice that the mass is beginning to grow. From that suprapubic region, is growing upward, now around the navel area, now growing up, occupying a larger part of the tummy. So this all happens, for the masses. Then for the heavy menstrual bleeding, the woman begins to complain of heavy menstrual bleeding. Bleeding becomes very heavy at every time of the cycle. The cycle is regular. If she sees her flow every 28 days of the cycle, she still sees it like that. But as against the previous flow, where she uses just one sanitary pad, maybe two strip of pad per day, she now uses up to say 5, up to 6, up to 7. And sometimes a period that was just lasting for 3 to 4 days now begin to last up to 7 days. It's what we call menorrhagia. It's one of the commonest complaints, commonest symptoms you will have in these women with uterine fibroid. It's very common, and sometimes they can bleed so heavily that they now become dizzy because they have anemia, their blood level is low, so and all that. So it happens. Now, the other problems that may come from the complaint they may give when they come to your clinic are those pressure effects, the symptoms that come with the effect of the fibroid. One is pain. There are certain reasons why a woman with uterine fibroid will have pain. One, the fibroid could outgrow its blood supply and begin to degenerate. There are different types of degeneration. It could be atrophic, it could be hyaline, it could be rare degeneration, which you will find in pregnancy, calcific degeneration. There are many, but in each of these degeneration, the woman will feel pain because the fibroid has outgrown its blood supply. That's on one hand. Now, the second reason why a woman may feel pain, a woman with fibroid, is the fibroid may begin to compress structures. When it grows and becomes very big and start compressing adjoining structures, abdominal structure, the woman begins to feel pain. And then the other symptoms is the fibroid may become infected. When the fibroid is infected, the woman can also feel pain. And then some fibroid can grow and then form a stalk. When you have a fibroid that have grown and have formed a stalk, it can get twisted, what we call torsion. So when a fibroid undergo a process called torsion, it twists, the woman will continue to feel pain. Sometimes they can't stand it, in which case you have to rush them into the theater, to remove that fibroid. So some of the things happen. A fibroid can grow so big that it begins to compress the ureter, causing urine not to flow very well from the kidney through the ureter to the bladder to the urethra, and begin to distort the anatomy of the urethra, of the ureters, causing backflow of urine, causing hydronephrosis. It can actually damage the kidneys if the fibroid compresses it for a long time without intervention. Outside that, because of the continuous compression, you could have what we call stasis. Stasis can occur and the woman begins to have recurrent urinary tract infection. So it's one of the complications you could have in women with long-standing uterine fibroid. But outside this, early satiety too, which is a pressure symptom from compression, fibroid, compression of the stomach, making the woman not to eat well. And when the woman is not eating well, she could begin to emaciate because the nutrient intake is poor. So you can see the effect of not eating, which could also be partly because of the fact that, the complication that has arisen from the fibroid itself. So these are some of the things that happen. But outside this other complication, the commonest you will find is the abdominal swelling, heavy menstrual bleeding. Intermenstrual bleeding can happen, but rarely does it occur. So oftentimes it's menorrhagia, which is heavy menstrual bleeding. And that heavy menstrual bleeding occurs. It happens because the fibroid has increased the surface area, mainly of the cavity. If the cavity is, the uterine cavity is really very small, just about 4 mils.
Yes.
The weight of the uterus is just about 4 grams. Yes, with a volume of about 4 mils. So you can imagine that a cavity increases so much. For some can be over 1,000 mils. So you have a lot of surface area to slough off. So once that surface area increases, the chances of having more bleeding is very high. And then because the fibroids are there, the uterus is unable to contract very well the way it ought to have been if the fibroids were not there during regular menstrual flow. So all this will lead to heavy menstrual bleeding, and it's one of the commonest things you can have. Then sometimes they could have thrombocytopenia. They have problem with their platelets, and that will further worsen the risk of their bleeding. So these are the common things you will find, very common symptoms you will find. Infertility, yes. Yes, you know, there's this controversy about fibroid causing inability to get pregnant. Fine, you know, you see that, like I mentioned, so many women have fibroid. There are so many women with uterine fibroid who have been able to deliver successfully without any issues. There are very many. Fibroid is not a documented cause of infertility, you know, but it can actually have a lot of influence on fertility potential, particularly bearing the location of the uterine fibroid. Those that are located in places where the baby is supposed to form, like the endometrial cavity, are more likely to cause fertility problems. When they are located in such areas, the woman may find it difficult, one, either to conceive, or she now start having recurrent pregnancy losses from the fibroid, the effect of the fibroid on that endometrial cavity. Even when the woman is able to conceive, risk of miscarriage is also there. And sometimes risk of preterm labor, even preterm birth are there. And of course, if the woman eventually gets to term and the fibroid is in the lower uterine cavity, within the lower uterine cavity, the chances of the woman having interventional delivery, because the baby may not be able to come out if the fibroid is in that lower part of the womb where the baby is supposed to pass. So the risk of performing a cesarean section in such a case is very high. So these are the issues. So, you know, so these are some of the issues you consider in a woman with uterine fibroid. But by and large, it's not just such a documented cause of inability to actually conceive.
Thank you, sir. Because this whole conversation with regards to fibroid and pregnancy, I've heard women ask me that they say I have fibroid, and the reason why I can't give birth is because of the fibroid. And I don't know, does they do anything with the location of the fibroid and the tube? Because I don't know who are the people telling them that you can't get pregnant as long as you have fibroid.
Okay, you know, fibroid can occur in different parts of the womb. Now, the womb has different parts. You have the neck of the womb, the cervix, you have the endometrium, which is the cavity.
Dr. Fred, can you hear me?
You have the cavity, then you have the myometrium, which is the wall of the uterus. And then you have the serosa, which is the outside part of the uterus. Now, the fibroid located just within the surface of the uterus, the serosal surface, is the subserous fibroid. The one located within the muscles are intramural because they are located inside the muscles. The one located inside the cavity are submucous fibroid. Now, outside this, there are other types, locations of the fibroid. Some can be ligamentary. Now, let me talk about the one that are located within the cavity. Fibroids that are located within the uterine cavity are more likely to cause fertility issues than fibroid located in the other part of the body. Now, this also depends on the size of the fibroid and how much the fibroid had distorted the anatomy of the cavity. Because you need an intact cavity for pregnancy to be successful in any woman. The pregnancy can happen, but if the cavity is distorted, the cavity of the womb is not clear, you know, you have multiple fibroids within, the chances that even when that woman gets pregnant, it will cause early miscarriage is very high. So it's not absolutely untrue that fibroid could cause inability, infertility, because in causing these recurring problems, it makes this woman infertile. You get what I mean? So yeah. That's actually that's what happens with the fibroid. That is why there are also evidence, you know, in which certain women, after performing the process of removing this fibroid, they get pregnant successfully. So it's very important that in a woman, you're unable to see other causes of inability to get pregnant. You're unable to see other causes of inability to get pregnant other than the fibroid you are seeing, for you to intervene and remove those fibroids. Inability to get pregnant is a couple problem. It's not just the woman's problem. It's a couple problem. It could either be coming from the man in over 35% of cases. These days, we're having more male having, causing infertility in women. It could be coming from the man. It could also be coming from the woman. It could be due to hormonal factors in the woman. The woman has hormonal problem, anovulatory cycles, polycystic ovarian disease, and all that. It could come from the fact that her tubes are blocked. Is having bilateral tuber blockage, or the fact that the endometrial cavity is compromised, like you're having multiple lesions, polyp, fibroid, and all that within the endometrial cavity. So it could be a uterine factor. It could be even a cervical factor. A woman could have recurrent pregnancy losses from incompetent cervix. So it's not just the fact, it's not just focusing attention on the woman alone. A woman could have fibroid, but the husband has a very low sperm count or can't even produce sperm. So even when you are trying to investigate the reason why a woman is unable to get pregnant, and you are seeing the obvious that the fibroids are there, it's also very important to also evaluate the man to be sure that the sperm is adequate and is fine, is able to fertilize the egg of the woman. And also the fact that the woman does not have any other factor such as tuber blockage, or the woman does not have factors like hormonal and ovulatory problems and all that, rather than just focusing attention on the fibroid alone. When you are now unable to see other causes of the problem, you can now calm down and say, okay, probably is this fibroid that is causing this problem. And also let me consider the location of this fibroid. It's possible that this is the problem this woman is having. So particularly those with unexplained infertility, if there's any cause to find that the woman has a myoma, a fibroid, particularly when it's submucous, all efforts must be made to remove that fibroid, because it can actually help, potentiate or facilitate the chances of the woman getting pregnant. Certain fibroid can even kink the tube. Some fibroid can kink the tube. There are certain fibroid that are located within, that are ligamentary, are located within the corner end of the uterus and all that. They can kink that tube, and even when you try to see whether the tubes are patent, you may not be able to know. So fibroid can be a significant factor when you are dealing with female factor infertility, particularly when you can't really trace or find any other cause, any other factor that is causing the inability for the woman to get pregnant. So you must identify that fact and sort out the fibroid.
Now, question is, sir, there are different treatments for fibroid, which I think you will tell us. So I think when you are telling us about the different treatments for fibroid, one of the treatment most people do in this part of our country is surgery. Let me just use a normal word everybody will understand: surgery. And I also want you to tell us factors, things that we need to see before we say yes, we must do surgery for this patient. I know that most people that they can just go to the hospital, and when they say they have fibroid and they start crying, hey, surgery, or the doctor will just be hammering, you are going to do surgery, even when maybe you are not even supposed to do anything for that woman at that time. So please, can you tell us the treatment and also factors that will save, that will make us really say yes, this one?
Thank you very much. Thank you very much. Now, I was talking about the symptomatology. I said there are many women with fibroid, but they don't have any symptom. Over 50% of women with uterine fibroid. For such women, you don't do anything. It's expectant. You just reassure them and tell them to go. That even the procedure of you trying to treat will cause more problems to them. You don't treat. You just leave them if they are not having symptoms at all from a uterine fibroid. Except you feel that the masses are becoming so huge that it may probably cause problems to the woman. Then you can just, find a way to intervene. The minimal way you could intervene. And then secondly, women, you may that may require interventions are those who are symptomatic. And like I mentioned earlier, symptoms of fibroids varies widely, has a wide variation. And the commonest symptom that you will find in women with fibroid is abdominal swelling and heavy menstrual bleeding. The other one is pressure symptom, which causes most of the complications you will have in these women. Now, there are some options that you need to consider for women with uterine fibroid. Now, definitive treatment of fibroid is hysterectomy to remove the womb. But you see, most of the women that are coming to you with this fibroid are still within their reproductive age group. Some have not even given birth at all. So why would you not want to remove the womb of a woman who has not even given birth at all? That is where the conservative approach comes in. The conservative approach could be conservative medical or the conservative surgical. The conservative medical, in which you just want to give medications to control symptoms. And then there are some you also want to do conservative surgical, in which you want to remove the fibroid and preserve the womb itself. The common reasons why people do conservative surgical is to preserve the fertility potential of that woman. For that woman to have womb to deliver at the end of the day. Otherwise, if a woman has completed her family size, she's satisfied with the number of children she has, and the woman is very symptomatic, having recurrent heavy menstrual bleeding, having huge abdominal swelling, the best option would be to what? To remove the womb. Yes. And also, you also take, this part of the world, then there's a lot of cultural things to some of the things we do. Many women want to keep their womb till the next life and all that. Some of them, when you counsel them, they'll tell you, this is my womb, you will not remove it. I want to have a womb when I come back to my next life. So a lot of things happen. So you must also have this cultural sensitivity and all that. You shouldn't be pushing. You should give the best, at